So thanks for having me back again today. I'm Rochelle Poffenberger. I'm an acupuncturist and clinical nutritionist. I have two offices, one here in Murfreesboro, and we do accept VA insurance at our Murfreesboro office. And then I have another office in the Franklin, Brentwood area. We don't take insurance over there, but we're working on it. So slowly but surely. So question, how many of you have had acupuncture before? Oh, okay. A little smaller crowd than last time. Gotcha. And can I ask, was the acupuncture for headaches? Acupuncture is used to treat many different things. Most people come to acupuncture first for pain. The number one thing that we treat in the United States is low back pain. The second thing that we treat is neck pain, and the third is headaches. So pain is kind of our forefront. We tend to get referrals when pain has some kind of neurological involvement, whether that be a pinched nerve or neuropathy, neuralgia, but where the nerves seem to be effective. Acupuncture is a fairly non-invasive way to stimulate blood flow to the nerves and to increase the healing process at a faster rate. So it can be a great complementary therapy to physical therapy, to chiropractic, post-surgery, and other pain management techniques. But today we're going to focus a little bit more on how acupuncture works with headaches, or how it supports headache care. Last time I felt like everybody knew everything about acupuncture and my slides were a little bit basic. So I tried to up the ante a little bit this time and give you a little bit more traditional Chinese medicine and the breakdown of how we diagnose headaches and how we treat them a little bit differently than in Western medicine. So first of all, most evidence with headache care comes along the lines of three very specific types of headaches. One would be like migraine headaches, the other would be tension type headaches, and the third would be cervicogenic, which means it basically is coming from your neck. So the pain radiates from the neck, sometimes even the jaw. But these are the three main types of headaches that have been studied. Obviously, we've treated all kinds of headaches. But these are the ones that we have some kind of tangible results over a long period of time. Now, Chinese medicine is over 3,500 years old, and I imagine one of the first things that they used acupuncture for and herbal medicine was some kind of pain, likely headaches. So there are many different pattern differentiations that we associate with headache type pains. That stem beyond just these three main Western diagnoses. And so we're going to get into that a little bit today. Has anybody had a headache that they have been treating for maybe a very, very long time with a lot of different methods? And maybe it gets better sometimes, but it just keeps coming back over and over again. So this is usually where I see patients come in. When they've said, okay, I've gone and gotten all my blood work, I've gotten MRIs done, CT scans, I've gotten an X-ray, MRI of my neck, and I'm giving pain management, told to ice my head when it bothers me, or to rest in a dark, cold room and then just wait for it to pass. Sometimes a prophylaxis is given that can help to prevent some of the more intense type migraines, but a lot of times it's really just pain management after that pain has arrived. So we like to initially differentiate the headache via Western medicine. If you come to us and you say something like that, where I've been suffering from headaches for years and years and years, I've tried so many different things and nothing gives me long-term relief, then we want to quantify what that actually looks like. I want to rule out things like blood clots. I want to rule out things like tumors, and maybe even herniated discs or some kind of head damage or head trauma. And then outside of that, I'm also going to want to rule out things that might show up in blood work, like inflammatory markers, low hemoglobin, low iron, low B vitamins, maybe even some low vitamin D. So once all of that has been cleared, then you are ready to see an acupuncturist. So we want to get rid of like all the things that might be causing secondary headaches, and then treat the inflammation or the blood stasis or the vasculation issues afterwards. So most of the time, these are the kinds that we're seeing. We also do see a lot of cluster headaches. We see a lot of secondary headaches. But again, we want to rule things out first before we start going down the TCM pattern differentiation. Now, aside from figuring out what is causing your migraine or what is causing your headache to begin with, and maybe it's like, well, we don't know. It gets worse with stress. It gets worse around a cycle, hormonal changes, lack of sleep. There might be many different things that could set it off. But it may be only on one side of your head over and over again. We have four main areas that we differentiate when a patient comes in. And part of the differentiation of these patterns is not just where the headache is located, but then also what other channels might be involved with it. Now, the channels or the meridians in Chinese medicine are named after organs. Namely because these channels, they're like lines, like your nervous system or your circulatory system. They're connected to those organs, and so that's how they get their name. It doesn't necessarily mean that there is something physically wrong with the stomach or the large intestine because that's the line that it's on. That's just how we categorize each of these meridian lines. And so Yangming tends to be like frontal headaches. Xiaoyang, when we're talking about that, they're like side headaches, maybe the temples behind the eyes. Taiyang would be a little bit more occipital. This is the one we see a lot, the most of, in fact. And then Jueyin is more like a vertex or root pattern. Interestingly enough, about the Jueyin one, where we see it involved with the liver channel, but also with the kidney and the blood and the yin. Most cases, when a patient comes in with headaches that are right at the top of their head, it's usually due to blood pressure issues, whether they're high or low, which is also very interesting how it's tied right into the kidney channel in Chinese medicine. And that was something they developed before even realizing that our kidneys or water regulation had anything to do with blood pressure. So there are some correlations. And then a lot of times patients will come in with a combination of these things. Once we get the area of the pain or areas of the pain, then we can start differentiating out root patterns and also secondary patterns that might be involved with it. And this is everything from, do you have any prior history of injuries, neck, shoulders, back, head? Do you have any trauma that might have caused brain inflammation or just made stress responses that much stronger? Or do you suffer from allergies? Interestingly enough, I had a patient come in. He was coming in regularly for, he didn't call them headaches, he called them head pain. And he would say that he gets head pain in the back of the head, in that occipital area, that Taiyang representation. But then he was also getting pressure just right in the front of his head, always in the front of the head, above the eyes. We were able to reduce the tension through acupuncture, some body work, some infrared therapy. I believe he was also seeing a chiropractor. And so he was like, man, my pain levels have gone down. My migraines are gone. The tension that I was feeling in the back is gone, but I still have this pressure in the front of my head. And so, we went down the rabbit hole, went and did some blood work, made sure that he had ruled out everything, talked about family history, past medical history, nothing. And then, one day I was like, you keep saying you don't have allergies, but this sounds a lot like allergies. And we live in Tennessee and everybody has allergies here in Nashville. And so I said, why don't we just try this? Like, tonight and for the next like 5 to 7 nights, just take a Benadryl before bed. And I am usually the one who goes with food, herbs, homeopathics, that kind of treatment before we go to over the counter or Western medicine. But in this case, we had kind of ruled everything out, and that was the only lingering thing left. Anyway, long story short, 3 days after doing the Benadryl, pressure, headaches completely gone. He's like, oh my gosh, nobody has ever brought that up. They're always just so focused on the tension in the back. And we're like, well, headaches aren't just one thing, right? It's a lot of times we're being inundated by all kinds of things, and we focus so much on what the worst and biggest pain is that we tend to rule out some of the simplest things that might be causing our secondary issues, or we have headache pain and we group it all together and think, okay, well, medication has made it get XYZ better, but I guess I'm just always going to have to live with this extra thing. I guess all that to say is it's very important to make sure that you're not like just ruling things out and saying you have to just live with it. He's very, very happy, by the way. That it was a very quick fix. So further along the TCM pattern diagnosis, a lot of the times what we see is liver yang rising or liver fire, usually due to some kind of liver qi stagnation. Now, again, when we talk about the organs in Chinese medicine, we're not talking about the organ itself, except in this case. Typically, when we talk about liver, we're talking about stress, or what we call modern day syndrome. Most of us are inundated with traffic. We're on our phones. We're in front of a computer when we get to work. Then we're back in traffic, and then maybe back on our phone by the time we go to bed. And in Chinese medicine, the liver opens to the eyes. So all the stress we take in through our eyes affects our liver more than any other organ. And we find that like visual stimulus, constant stimulus, can create a fight or flight syndrome without us even really realizing it. So when we talk about liver yang rising, a lot of times that is referring to a stress syndrome, but it also can be talking about high blood pressure, anger that's triggered by stress, some kind of general emotional based headache that can then turn into a physical based headache as well, where that liver qi stagnation then becomes tightness in the jaw, TMJ pain, PMS symptoms, or other types of like vascular issues that might cause like some temporal pain. And then, of course, there's like the phlegm damp or the foggy headedness. This is where that gentleman I was explaining to you, those lingering symptoms that he had just kept screaming that there was dampness, there was some kind of phlegm going on in the system. And sure enough, phlegm easily translates to mucus, and mucus is with allergies almost undoubtedly. So whenever we see patterns like that coming up over and over and over again, we're like, okay, let's just try to figure out what keeps causing this. And like I said, in Nashville, it's kind of easy because everybody has allergies. Blood stasis, this is more of a post-traumatic headache. And blood stasis sounds a little scary. It does not mean blood clots. So most patients who come in with with most of the headaches or neck or shoulder or back pain, there is some kind of blood stasis involved, whether that be post-traumatic after an injury where the body is protecting or is just tight and spasm because of the trauma. But it can also be like post-traumatic where maybe you hold tension in a particular area of your neck or shoulders and you've done it for so long that those muscles have become very strong and very good at cutting off blood supply. And so we call that a blood stasis. And this is where we'll recommend lots of body work, cupping, gua sha. These are all myofascial techniques that help to stretch the fascia, move blood flow, and maybe tear up some of those muscle fibers so that they can regrow in a more relaxed position. And then we might also recommend blood movers like turmeric or curcumin, boswellia, and maybe arnica, something like that. Differentiation or deficiency patterns tend to be where we're talking about the deficiencies of the blood, like hemoglobin levels, iron levels, B vitamin levels, and then just general malnutrition. I have a lot of patients who come in pretty regularly with this low grade, oh, my head just hurts. It's hurt all day long. I've taken Tylenol. It hasn't helped. And guess what? They're the ones that don't drink water throughout the day. They're the ones who have skipped their meals throughout the day. And they may do it on such a regular basis that their headaches seem to be just ongoing. But also their self-care is just so bad that, of course, their headaches are ongoing. It's trying to tell you something is wrong. Lots of different patterns with the deficiency patterns, including hormone deficiencies. So we differentiate all the way through to figure out what exactly is causing the issue so that we can correctly treat it. And then here are just some treatment recommendations that typically come with them, the acupuncture points that we would use. Now, what I handed everybody out today is an ear seed kit. Now, ear seeds are a fun little tool in an acupuncturist toolbox that we will use for pain management, sleep management, and stress support in between treatments. Ear seeds work a little bit differently than acupuncture because they work on acupressure. In acupuncture, we use needles to bypass pain centers in the body and then get the body to go into a parasympathetic state by the release of the different neurotransmitters that happen when we hit certain points in the body. With acupressure, we actually want to hit the pain centers. So there are little diagrams in each of your ear seed kits, and the diagrams have specific points on them that are used to treat those different conditions that are in the boxes. When you use them, you want to not only find the point, but then you also want to squeeze it until you feel pain, and a lot of pain, actually. So once you've done that, you'll get an endorphin release because of the pain, but you'll also get a nice dopamine release, a little bit of serotonin, and then some other anti-inflammatory hormones that are released when we have a pain response in conjunction with hitting specific points on the nervous system to then increase blood flow to that area. So enjoy. The acupressure seeds are quite literally seeds from a Vaccaria plant. That's why we call them ear seeds. And they're attached to a Band-Aid. So you would literally just stick them on the point and then you squeeze it. You can leave them on your ear for up to like 4 or 5 days. You can wash and everything with them. They're just like a Band-Aid. After about 4 or 5 days, they tend to get a little gooey, and then most people just kind of pull them off. But the beauty of these things is that there is nothing in them. They are literally, there's not even, they don't even puncture the skin, and they can last for that many days. You can squeeze them every like 4 hours to elicit that anti-inflammatory response and give yourself a little bit of pain relief. It's a nice quick fix whenever you need like a good couple hours of just relief when you're suffering from tension, headaches, even migraines. Definitely not like a replacement for the real thing, but it is a nice like in-between thing to do. For the conditions that are indicated on the cards, you would want to use all the points that they have listed there. And I think the cards, there's stress, sleep, and then addiction. Now, addiction is an interesting one. This is a NADA protocol that was actually developed in the prisons back in the 60s. And they did so as an experiment to show that acupuncture could pull people off of their narcotics, that it could be a non-drug way to help not only reduce pain, but also reduce opioid and drug use. And the acupuncturists went in and they developed this 4-point NADA protocol, which is listed on one of those cards. And it became known as this addiction protocol. But what NADA really is it targets the parasympathetic system It targets our pattern recognition system. And so it's really good for any kind of recurring pattern, whether that be recurring stress pattern, recurring pain pattern, recurring thoughts, recurring habits. So it's a really great one to use for really all kinds of things. You can put them on both ears, but you only need one ear. Usually, I recommend that you use the ear that you're not going to be sleeping on because sometimes, even just laying on those ear seats, it starts hurting. Thank you so much for having me here again today.
Good morning. My name is Dr. Austin Voigt, and I am the owner of Tennessee Chiropractic Clinic. And as you guys know, we're talking about headaches, and we'll go into a little bit with migraines as well. Now, I I may repeat a little bit of the information that was just spoken about, but hey, it's good to hear things twice. Then it solidifies it a little bit better. So, all right. So, the reason we're talking about headaches is because they're very prevalent in society. So, it's estimated that about 50% of people suffer from headaches annually. So, that is a very high percentage and a very high number of people. So, we're talking about millions of people suffering from these either annually, some people even daily. But headaches are also one of the leading causes of disability. So, they greatly affect, your everyday daily activities, your mental health. It can really put you into a bad spiral if you're, in pain every day, especially with headaches. That can affect how you think, your mood. It can really affect everything in particular, but it also will reduce your work productivity and just your overall quality of life. So it's a very important topic to discuss, and there are a number of things that we can do to help with that and get them under control. So really quick, the difference between headaches and migraines. So migraines tend to be a bit more severe. Now these are generalizations, but this is kind of what we have found over the years of researching it. But migraines typically are one-sided and can present as a very painful, throbbing type pain. They can last from hours to days. So they typically can last a little bit longer than just a traditional headache. And like I said, they can be a little bit more intense as well. They can come on suddenly. Some people have triggers, which we'll talk about later as well. But they can also come on with an aura. So these are visual disturbances. Some people describe them as like electricity in their vision. Some people can see like it can be like blind spots almost. When I've had a migraine in the past, it's been more like an old school static television where it's like the black light static, and that can kind of go in blotches throughout your vision as well. And so that usually is not with headaches as well. That's just typically migraines. And they also can have some neurological effects as well. So you can have tingling or numbness, especially on like half of your face. It can cause dizziness, as well as nausea and potentially vomiting as well. And then, when people do have migraines, typically loud noises and bright lights are something to be avoided because you can have a hypersensitivity to those as well. And with headaches, usually they are more bilateral. Now, there are a lot of different types of headaches. So, like I said, these are generalizations. And we'll dive into the different types here in a second as well. But usually it's more of like an aching and a dull pain. It can still be throbbing, but usually a lot less debilitating. And typically they last hours to maybe a single day, but not usually multiple days repetitively. And like I said, typically you don't have the aura present as well. So, yep, going into the different types of headaches. So this diagram shows quite a few different types of headaches. Now, there are a lot more than even just this, but this diagram kind of goes into more the common ones. But tension headaches are something we see a lot in the chiropractic clinic, and those are the ones where you get a tight band feeling, kind of around the whole upper area of your head. And like I said, it usually goes both sides as well. Cervicogenic, just like it was stated before, those are headaches that are coming more so from the neck. So we see a lot of those at the chiropractic clinic as well. Sinus, very common here in Tennessee, especially right now. Cluster headaches are extremely painful. They're still doing a lot more research on those. Usually that is more one eye behind one eye, and they're trying to figure out what's causing those. And there are ways to relieve them, but they're still doing a lot more research on the cluster headaches. Occipital neuralgia, that's one that we deal with in the chiropractic clinic as well. So that's coming more from the base of the skull back here, where pressure can get put on that nerve and then cause a headache. Blood pressure, high blood pressure, is a big one as well. And then there's other ones like caffeine too. If you are have a regular coffee every day and then you miss that, that can cause a pretty significant headache as well. And then hormonal as well. So different times of the month, sometimes it can be cyclical, and they can come and get you that way. So it's very important to identify what kind of a headache are we dealing with here, and what is the category there. But equally as important is identifying the triggers. So like we went through, allergies and caffeine; those can be big triggers for headaches. But dehydration, just like it was stated earlier, is huge. It's a general rule of thumb to try to be able to drink half of your body weight in ounces of water a day. Now, that's just a general rule of thumb, and that's a bare minimum as well. So say you weigh 140 pounds, shoot for 70 ounces of water per day is the minimum goal. So that's like a baseline. Really, we should be shooting above that as well. But I see patients all the time that, they come in with a headache. My first question is typically, are we drinking water? And a lot of times the answer is no. So that's kind of, a good starting point. And really, drinking water is going to detoxify your body, pull stuff out as well. But really, we need to stay hydrated. So that's a big one. Weather changes, as we have experienced even last week, going from 75 and sunny to snow and 38. Those are big barometric pressure changes. So that's scientific as well. So not only will people have more pain in their arthritic joints, because of those big pressure changes, they will also have there's usually an uptick in headaches as well because of that. Stress is a massive one. And that one is probably the hardest one to get under control. Now, there are a lot of techniques that we can work with to start to work some of the stress out and be able to manage it. But a lot of times that's easier said than done, right? We all have our ways of coping with stress. But we can go over some strategies later as well to try to reduce those. And a lot of times clenching your jaw can go along with the stress. So like when you're more stressed, some people subconsciously be clenching their jaw, and a lot of the jaw muscles, you have them down here, but they also go into the temples as well. And so those can cause headaches as well. And then another big one for chiropractic and physical therapy as well is the poor posture. The more I've been in practice, the more I've seen that posture does make a massive difference. Poor posture can restrict blood flow. It can cause muscle tension, and then that really can feed into the cervicogenic headaches, the ones coming from the neck as well. And we'll dive into a lot of this later to give you some strategies and everything as well. So how can chiropractic help? So I deal with headaches is probably one of the most common things I deal with as well. And it's one of those things where when someone comes in with a headache, I get excited because I know how much relief we can get them, and usually it's relatively quickly. Because headaches, like we had talked about, are so debilitating and they're miserable to live with. But with chiropractic care, along with acupuncture and physical therapy, we usually can get these under control pretty quickly without drugs or surgery as well. But it all starts with taking a very thorough health history. You can get a lot of answers questioned just from diving into a health history, and by doing so, we're trying to identify what type of headache we're having, how often are these affecting you, how long do they last, and then obviously those triggers are massive as well. It's very, very important to identify those triggers, because then you can either learn to avoid them or learn to deal with them. It just depends on what the triggers are. Then we dive into a physical exam. So we'll take a look at your posture, look at your range of motion of your neck, see how everything's functioning there, and then we'll actually feel your neck and at the base of the skull as well. Dive into the jaw a little bit, into the temples, see what we're feeling with that as well. Because usually with headaches, you will be able to identify specific areas that need work. There we go. All right, so then we dive into like an orthopedic exam. So we'll test the joints as well as a neuro exam. So we're going to be testing the joints, looking for muscle tightness, looking for any asymmetries, whether that's in the neck or at the base of the skull. And then we'll dive into the neurological testing as well. So we'll test the reflexes, see if there's any nerves that are being impinged or affected. We'll test the muscle strength, once again, testing for the nerves and the sensation as well. So that also will dive into like, okay, is this a migraine or a headache? Because sometimes you can have numbness or tingling from the migraines as well. And then as a practitioner, always the most important thing is trying to rule out those red flags, like what was discussed earlier. You're trying to rule out vascular causes, rule out space occupying lesions. So that could be like tumors, and there's other stuff as well, and infection. So once we rule all that with the health history and the exam, then we can dive in and to get into actual treatment. So usually treatment is multifactorial. So these are all things as a chiropractor that I do. So first and foremost, I start with adjusting because that's our bread and butter. Okay. And so there are multiple different ways to adjust. So a lot of people are familiar with like the manual style. But that can also make people nervous. And I promise it's not like what you see on social media. Those videos are a bit embellished and a bit aggressive. I can do manual adjustments and they can be very gentle as well. But we also have, for people who don't like those or don't respond well to those adjustments, I can also do instrument assisted adjustments. And actually in my practice, I don't have an exact percentage, but I would say upwards of 60 to 70% only get the instrument adjustments. They just like them. You're relaxed the whole time. And we'll dive into that in a second here as well. And then there's myofascial release and trigger point therapy. Trying to strip the tight muscles that could be putting pressure on nerves or restricting blood flow to the brain. Stretches and exercises, typically to correct posture with related to headaches. Ergonomics is a big one as well. And then obviously the lifestyle changes. So we'll dive into all those right now. The manual adjustments is your traditional style of adjusting. Sometimes you do hear a pop with that. Now that pop is just gas rushing into the joint space. So it's a side effect of the adjustment. Doesn't actually mean much. Some people will pop a lot. Some people won't pop at all. So it's just more of a side effect of the adjustment. But what we're trying to do is we're trying to restore range of motion, proper biomechanical function to the areas. And with this specifically with headaches, typically that is the neck. So what can happen is the joints can get restricted, and then areas have to compensate for those restrictions. That can then bring pain and inflammation in, put pressure on nerves, or even the blood flow, and that can further lead to headaches. So the adjustment really is for restoring all that normal function, but also to put an impulse into that nervous system, to reset the nervous system, let it know like, hey, this is a problem area that we need to fix, and start to regulate those nerves again. Okay. And then it also will help restore range of motion. So the instrument adjusting, so this is the instrument that I use. It's called the ArthroStim. It can do a single impulse or it can do a repetitive impulse. But they're extremely gentle and very comfortable. So there's no twisting or popping with this one. So you're usually just lying face down the whole time. And then I can work from our feet on up and work on aligning the spine as well as restoring just normal function and normal range of motion to each joint. It's also very safe for people with osteoporosis, arthritis, or higher sensitivities. So that's a good option as well. So you don't have to worry about any of those kinds of things with the instrument assisted adjusting as well. And also great for people who have had previous surgeries or spinal fusions, because we can very easily work around those areas, and it's completely safe for those as well. So now going into the myofascial release and trigger point therapy. So This is what I like to call the headache hotspot. It's from the upper neck, which is about your top three vertebrae of your neck. And the suboccipital muscles connect to all those areas. But these are the muscles that we work on quite a bit, especially for those neurological headaches coming from the occipital neuralgia. But I've found that a lot of headaches, regardless of the headache, will respond well to this. So what can happen is, so these are all at the base of your skull back here, but these muscles, whether due to stress or poor posture, with our heads going forward, they can get overworked and get very tight and spastic. And what that'll do is it can, I should say, restrict blood flow to the brain, and also put pressure on nerves, and that can cause a headache. So a lot of times while I'm working on these areas, the patients are actually feeling the pain, usually in their forehead, behind their eye, or a little bit sometimes at the top of their skull as well. So usually it'll travel to other areas, and a lot of times that's where they actually are experiencing the headaches. So when we can reproduce that, then we know, okay, that's directly where it's coming from, and we have to get that fixed. And then stretches and exercises. These, like I said, are typically with regards to headaches, typically to fix posture. And so what this diagram is showing is, when your head is directly on top of your shoulders, where it's supposed to be, your head weighs like a normal 10 to 12 pounds. That's on average. But for each inch you are forward, due to physics, that's an extra 10 pounds that all these muscles on the back side of your neck and your upper back have to work to pull it back. So each inch you're forward, these muscles have to work double time to pull it back. So that's where those suboccipital muscles can get so tired and fatigued and spastic, because we're bring our head so forward for so long that we have to work on bringing it back. So another way of describing this is if you hold a bowling ball close to your chest, it's pretty easy. But if you hold a bowling ball away from your center of gravity, a lot harder, right? You'd fatigue a lot faster. Well, your head's the bowling ball. And so we want that on top of our shoulders, on top of our center of gravity, so that those muscles, especially on the back side of your spine, don't have to do as much work. Okay, so that's why that's very important. And then, we're also trying to restore range of motion and normal function with that, with the stretches and exercises as well. And something that's very basic, very safe to do, that you guys can even start doing at home tonight is just simply rolling up a hand towel and just laying on your back with a hand towel beneath your neck. We do want this natural curvature here. And what happens, with phones, with computers and everything, over time, we just come forward and we actually lose that curvature as well. So we do want a little bit of curvature there. And this is something that's very safe and easy to do. Some people cannot tolerate 10 minutes at the start. So you start off very minimally, with like 1 minute, and then slowly build your way up. But it's very simple, very easy to do, and everyone has that at home, but it's something that you can try, to help with the posture as well. And then ergonomics. So this is one of those things, whether you're at a desk working all day or even just at home, scrolling on your phone, there are definitely proper ways to do it and bad ways to do it as well. So whatever you're doing, if you're at a desk, it's very important that your eyes, I actually like to have this even a little bit higher, to where my eyes, when they're in neutral, when you're sitting, I want them kind of dead center of the monitor. Okay. And then everything else, you just are trying to look for more neutral posture. So this will help, having a back support or a lumbar support will help you stay upright, and then having the feet be able to touch on the ground as well. That's at a desk. Now, I know a lot of people are more so, on the couch or recliner, with phones. And so the phones are a very tricky one, because you're not just going to hold your phone up all day. That would be, fatiguing as well. The best thing that I've seen for that is trying to hike up one or two pillows. So then your elbows so it's on your lap, right? And so your elbows would be on the pillows, and that tends to bring everything up a little bit more as well. Worth giving that a try. Like I said, the phones are a little bit more of a tricky situation, but it's something that we need to address because we all deal with them every day. And then also looking, a lot of research has been shown that the blue light will actually can trigger headaches as well. So getting a pair of blue light glasses while either on your phone or computer for long periods of time can help block that blue light and will actually help you sleep better as well. But it'll calm down your brain a little bit and reduce the amount of headaches that you can get. And then just taking frequent breaks. We're all made to move, right? Every joint in our body is made to move, so we're not made to be sitting for really long periods of time. So, whether that's once every 30 minutes, once an hour, get up, walk around, move, do neck range of motion, and try to restore that as well. And then lifestyle changes. So stress reduction is the big one there, because a lot of times when we get stressed, this is what we do. Our shoulders creep up, and all of a sudden your shoulders are tickling your earlobes, and that's not where they're supposed to be, right? And so that can, cause a lot of tension up there. And where does that go? It all goes up towards the neck, and then that can cause headaches too, right? So one thing to help a lot with, without trying to do that too much and breathing through our chest too much, is actually deep breathing techniques more through our diaphragm and through our stomachs. The research has shown that actually calms down your whole system, gets the parasympathetic, the rest and digest activated, and will actually calm down just your whole system as a whole. And that's how we're supposed to be breathing anyway. If you watch a baby breathe, they're breathing through their stomachs and diaphragms only. And really the only time we should be breathing through our chest and using our upper traps and everything is either like when you're working out or running from a tiger. So that's really when you're only supposed to be using those techniques as well. But exercising and meditation are two other really great ways to try to reduce stress. There's a long list of things to reduce stress, but trying to find something that works for you is most important, because if you don't like it or if you don't want to do it, you're not gonna. Just trying to experiment with different things is important. Drink more water. We talked about that. Good sleep hygiene is very important for reducing headaches. Going to bed at a similar time every night and getting 8 hours or so of sleep, very important with reducing headaches. And then identifying those triggers and either avoiding them or finding workarounds for them. So key takeaways: headaches are multifactorial. So it's not usually just one thing going on. Usually we can pinpoint a few different things going on, and the treatments are also not just one thing. Usually that's multifactorial as well. So that's why acupuncture will be, in addition to chiropractic and physical therapy, is going to be such a good thing, because it really, what I've seen is the practitioners working all together and for one common goal is always going to be the best for your health, not just one or the other. Usually, our bodies are very complex, and so the more people you can get to different views, different viewpoints, different treatment options, the better your body's going to respond and the better results you're going to get. And then chiropractic care is highly effective for treating them without drugs or surgery. And I do also want to throw in there, because I think I forgot to last time, is I do take insurance as well. Pretty much all the major ones. There's a couple that I don't, but insurance is usually pretty good at covering for these things as well, which is a good option to have too. But yeah, that's all about the headaches and migraines. And if you have any questions, feel free to contact me afterwards as well. All right, thank you.
How are y'all? Good morning. My name is Amir Hakim. I'm a physical therapist. We just opened up a PT clinic right behind you guys inside of the Avalon gym. So a little bit about Physical. Physical is a nationwide franchise brand. So there's over 600 locations nationwide. Will Put is my business partner. He and I opened up Hermitage first in 2023, and then Hendersonville in 2024. And then we just opened up Murfreesboro last month. So we're very excited to be here. I'm a local boy. I live here, so I'm very happy to not have to drive to Hendersonville every single day. So I'm happy to be home. And we actually did an event with Lois a couple years ago, and it was a great turnout. And some of you guys look familiar. I think I might have talked to a few of you during that event. But again, we're very happy to be here. And thank you guys for having me. So I think if I say one more time to drink water, you guys are going to start throwing stuff at me. But yeah, so drink your water to help with your headaches. So I don't want to be repetitive and redundant. I know Dr. Voigt and Rochelle covered a lot. So raise your hand if you pretty much have a good idea about what headaches are now and like how you get them, because I don't want to just keep saying the same things if you guys have already gotten it. Okay. So where physical therapy comes into play is we can show you guys the exercises that you guys need to kind of take care of it and maintain everything that you guys gain, whether it's in a PT clinic, chiropractic office, or acupuncturist office. And so, kind of like how they mentioned, it's best if we all work together. There's this weird phenomena in society that chiropractors and physical therapists are enemies. And that's not the case. I've sent my wife to chiropractors. I've sent my daughter to a chiropractor. Um, we're not enemies. Okay, so we complete each other pretty well. There are certain things that I can do that Dr. Voigt is obviously amazing at. And there are certain things that he just doesn't have the time for, that physical therapy is modeled to be able to spend an hour with you guys and show you guys different exercises, different stretches. Again, just to kind of capitalize on what we gain in the clinic, right? So if you come in with a headache, a lot of the headaches, again, kind of like how they mentioned, start back here. So there's something called the upper cross syndrome. Upper cross syndrome is where you have some tight muscles and some weak muscles. So if you look at me from the side and I do this, kind of like how a lot of us are, just because of life these days, we're like this. So, and we're kind of forward shouldered and rounded head like this, right? So you end up having tight muscles here and tight muscles here. And then you have a weak muscle in the front of your neck and then a weak muscle in your back. And so all PT does there is just reverse those. So we show you guys a lot of strengthening exercises to strengthen up your upper back and stretches to stretch all the tight muscles. And so that's where we can come into play. So for example, I have a patient right now in Hendersonville, because I still go out there sometimes, named Deborah. Deborah came to me about a month and a half ago with just a searing headache that wouldn't go away. And so after our assessment, we realized that it's that upper cross syndrome. It's because she is a grandmother, she has grandkids and great grandkids. She still loves to nurture and cook. And so she's just in the kitchen looking down like this, whether it's chopping vegetables or cooking or whatever. She's playing with her kids, playing on the iPad with them, phones, carrying them, just life, right? And so fast forward, 5 years of having her first grandchild. Now she's having that headache and it won't go away. So she comes to us, again, kind of like how they mentioned the suboccipital muscles. We were able to release those and work on them, do a little bit of traction, which is a decompression. And I think Dr. Voigt has a special machine in his office that does that probably better than I can. And then just showed her a myriad of exercises, things that she can do at home without a lot of equipment. And that's kind of the skill. The skill is showing you guys exercises that are repeatable, that I can just give you a handout and know that you can do it at home safely. And if you stay with them, that the headache just won't come back. Okay, so that's where we can come in. So I handed out this right here, me and Lois, and I'm gonna kind of just use this as my guide for the talk. So there is neck-related headaches, tension-related headaches, and then migraines. And a lot of the migraines that we see end up with vertigo. Raise your hand if you ever had vertigo or know what it is. Do you guys know what vertigo is? What is it? Dizziness. But why? Do you guys know like the mechanism of vertigo? Okay. Right. It's an inner ear problem. So we all have crystals in our inner ears. And in a perfect world, they're housed in this one structure called the utricle. Okay. And these are microscopic. I get this question all the time. Like, can an MRI show this? No. Because when I say microscopic, I mean, they are tiny. So these crystals are supposed to be in one spot. Vertigo is when they escape that spot and end up into one of the canals. And a lot of this is tied together. Okay. So we call it the ram's horn headache. So it starts here and comes around like a ram's horn, and sometimes it'll go around this way. If we can release these muscles, then we can release the cervicogenic aspect of the headache. And a lot of times, I don't know, I mean, you guys chime in, but 9 times out of 10, at least the headaches that I see are all cervicogenic. They're all just right here. Okay. But a lot of times it'll come along with vertigo, and the patient is just kind of bewildered. What happened? I didn't hit my head. I didn't fall. Why am I having vertigo? And the question is, or the answer is, I don't know. There's no answer for vertigo. There are risk factors for it, but there's no answers for it, right? But if you have a headache and it's going this way, then at least we know whether it's PT, chiropractic, or acupuncture, you guys have options. And I say that with a little bit of passion because a lot of people think, oh, it's just because I'm older and is kind of part of it. It's not. Okay? And I feel like I end up finding myself doing this on all the talks that I do, whether it's here, Hendersonville, or Hermitage, wherever, is you have to advocate for yourself. So if you go to the doctor and the doctor's like, yeah, you're 75, you have headaches, whatever. That's not normal. That's not just part of being in your 70s or 80s or even 90s. Headaches are normal. Dizziness is not normal. Pain is not normal. Okay, it's not okay just for you to live with it. And so in my practice specifically, kind of like Rochelle and Dr. Voigt, I like to look at the whole person. So how are you eating? What's your protein intake like? Are you drinking enough water? Are you getting enough sunlight? What is your posture like, generally speaking? How do you spend your time? What triggers do you have that will cause these symptoms? And again, it's always the little foxes, right? Beware of the little foxes. It's always things that you don't think of. Because sometimes it is just the weather. A 40-degree difference in a day is not ideal for anybody, right? I think the solution now is just wear a jacket, regardless. If it's hot, take it off. If it's cold, at least you're equipped and you have the jacket on, right? And going back to the vertigo thing, kind of tying it into the weather, I've had patients who come in with vertigo and headaches, and we get all that to go away. And then they have a sinus infection, and it all comes back within a day or two. They get a sinus infection on Monday, Tuesday they're back stumbling into the clinic because their vertigo is back and their headache is back. So that stuff has a huge impact on how you feel day in and day out. And of course, stress management and sleep hygiene. So there's a guy named Dr. Matthew Walker out of, I think, UC Berkeley in California. He has like 6 or 7 actionable steps to help your sleep hygiene, to help you sleep better. I'm going to quickly run through them because this ties in, again, to headaches and just overall stress management, and it's all tied together. So number 1 is no screens for an hour before bed. Okay? No drinking anything for an hour before bed. Again, these are things that we can all start doing tonight. As the sun comes down, you start dimming and turning off lights in your house to get your brain ready to sleep. Okay? No clock face in the room. And there's a reason for that. Because if you wake up in the middle of the night and you look at the clock, one of 2 things is going to happen. Either you're going to think, oh, I still have 5 hours to sleep. That's good. Or, crap, I have like an hour and a half to get up. Either one, it's an emotional response that will stimulate your brain to wake up. Whether it's a good thing, it's a relief that you still have more hours to sleep, or shoot, I got to be up in 30 minutes. So no clock face and no phone in the room. And the number 1 question I always get is like, how am I going to get up? There's no alarm and there's no phone. And my answer is just plug it in right outside the door. Just keep your phone plugged in. You'll still hear it, hopefully, right outside the door. But again, the phone thing is because once you wake up in the middle of the night, the first thing you're going to do is reach for the phone. And then kind of like Dr. Voigt said, blue light, and now your brain's awake and good luck getting back to sleep. Okay? So we said no drinking water or anything before bed for an hour, no screens for an hour before bed, no clock face, no phone. The temperature in the room should be about 68 degrees. And I know that's cold for some people, but that is just, has been proven time and time again in the literature. That is ideal sleeping temperature. 68 degrees. And then if you lay in bed for about 30 minutes, and I know there's no clock, so how am I going to know 30 minutes? Just ballpark it. If you're in bed for 30 minutes and you are not asleep, get out of bed. Because bed is only for sleep. And if you read in bed, if you eat in bed, if you're on your phone in bed, then your brain is going to associate bed with activities, but we want your brain to associate bed with sleep. So if you're in bed for about 30 minutes and you're not asleep yet, get out of bed. Now, don't get out of bed and turn on the light. Get out of bed and maybe turn on a lamp and just read for a few minutes. That always puts me to sleep. I don't know about you guys, but that always puts me to sleep. And then I'm ready to get back in bed. So those are things, again, actionable steps that you can do tonight to help your sleep hygiene, to help you sleep better and sleep through the night. And again, like Dr. Voigt said, 7 to 9 hours. That's ideal. Anything less than that is not good. Your brain doesn't get enough rest. Anything more than that, it's almost too much. It's like a bell curve. You want to be in the middle. You don't want to be too little or too high on that bell curve. Does that all make sense? Are you guys going to do any of that tonight? All right, I'm going to ask you guys tomorrow. We love doctors. I'm going to preface by saying that. We love doctors. We all need them. If your doctor doesn't ask you about your sleep, your eating habits, your hydration, how much sunlight you get, how much exercise you get, you don't have a doctor. What do you have? You have a drug dealer. Okay? If they just give you medicine without asking about anything else, find a different doctor. No offense to yours. I mean, I'm sure he or she is great. But I say this kind of jokingly, but also kind of serious. If your doctor doesn't ask you about your lifestyle and they just give you medicine, they're just pill pushers. Right? But you have 3 options. We're trying to avoid surgery. We're trying to avoid medicine. Right? Homeopathic approach, an approach that's been used for decades, centuries. Right? And myself. Nobody wants surgery. Nobody wants to be on another medicine. And medicine generally, Western medicine in general, is designed just to mask the symptoms. I challenge anybody to give you medicine that is designed to treat the symptoms or cure the cause or the underlying cause of it, right? I had a client yesterday She came in and she had 2 back surgeries. So she's going to have pain because she has hardware in her spine, right? I can't take away all the pain. But we're doing everything that should work. And she goes, I feel stronger. I feel like I have better mobility, but my pain's not going away. So we started digging a little bit deeper. She went to the doctor recently and they doubled her statin dose because her cholesterol was 205. Did you guys know that 20, 30 years ago, cholesterol can be 300 and nobody's going to say anything? Nobody's going to bat an eye. Now, all of a sudden, anything above 200 is, you're going to double the statin dose? I have a friend of mine, she's in functional medicine. I texted her on the spot and I said, hey, and I took a screenshot or a picture of my client's numbers and I sent it to my friend. I was like, should this person be on statin? Her response was, no lie, nobody should be on statins. Now, I'm not saying get off of them. I'm not here to like challenge what your doctors are saying. I'm here to give you guys another idea or another approach to the things that are going on. Her pain is not going away, not because we're not doing the right things, but because it's an uphill battle already because of the hardware in her spine. But also we're battling chemicals. We're battling the effect that her medicine has taken on her body, on her system as a whole. And she does a lot of right things. She exercises. She's 77. She does a lot of right things. She exercises. She gets a lot of sunlight. She owns her own business, so it's kind of a low stress environment because she doesn't have to get up and rush out the door every morning. Right? She's in control of a lot of her day. But even with all the good things that she does, her pain's not going to go away because they doubled her statin dose for no reason. My cholesterol is 217 last time I got checked. So 205 does not warrant a double dose of statins. Okay? And it's been proven now through the literature, actually Harvard just did a study on this not so long ago, that dietary cholesterol doesn't increase cholesterol. So you can eat all the eggs you want. And your cholesterol is not going to go up. Okay, I digress. But anyways, thank you. But yes, your doctor, if they're not asking you about all those different things, challenge the doctor, right? They're there for you. They're there to serve you. Whenever you come into my clinic or go to Dr. Voigt or go to Rochelle, we're there to serve you. So challenge us. If we don't ask you questions, you make us ask the questions. Make your doctors ask the questions. Ask them what they think. And here's something that I'm trying to get my parents and everybody in my life to realize. If you go into a doctor's office and the doctor's overweight and they don't look like they practice what they're preaching, like look at Austin. Look at Rochelle. Don't look at me. But anyways, look at them too. They're in great shape. So look at the people who are providing the care and providing the service. If they don't look like they're actually living the lifestyle that they're telling you to live, find somebody else. Right? This is your health. Ask us the questions. Again, we're here for you guys. We got about, I think, 20 more minutes. So I want to open the floor for whether it's me, Austin, or Rochelle. If you guys have any questions, any concerns, if you guys want to talk to us one-on-one, again, that's what we're here for. We're here for you guys. I think we're all local. We're all within like a 10-minute drive from St. Clair's. And we're all going to be back, I know, for different events. But I want you guys to know that as providers, our whole purpose, why we do what we do, is to help you guys feel better. And so if you have a provider who you don't feel like they're asking you all the right questions, they're not providing you with all the education, that's really the big one, is education. If you walk out of the office and you don't feel like you've learned something new, then challenge that person. Don't dismiss them immediately. But if you challenge them and they don't respond, find an educator. Find somebody who's going to tell you what to do, how to do it, how to manage your headaches. I think you guys can all leave here today knowing what headaches are, where they come from, how to manage them. And it all happened within an hour. Okay? So if you guys have any questions, blurt them out. If not, thank you guys for having me.